Thank you very much for the invitation. And it's my great pleasure to be here and share some of my research results. And it is, well, I look forward to going back to normal so that sometime soon we can meet in person in this FFT event. And hopefully this is the last time I give a remote talk. Okay, so let's start. So the motivating example for today's talk is liver transplant surgery. So when do you need a liver transplant surgery? It is particularly when you have liver failure. For many different reasons, your liver is dead, and without liver, you will die very soon. So what physicians can do is to replace your old liver by a new liver. After you get a new liver, you may survive get a new life. And as you can see, to remove the liver from your abdomen, this is not a trivial job. So physicians need several tools, monitors to monitor what's going on during the surgery. There have been several tools that physicians use, which I will not go into details, but the purpose is to really monitor the significant hemodynamic instability during the surgery. So usually, how does the signal look like for this hemodynamic monitoring? Usually, we can take a look at this arterial blood pressure signal, which looks like this kind of thing, which are recorded in different phases of the surgery. So you can see the morphology of the oscillation changes from time to time. And it's kind of periodic and so on. So traditionally, you can take those signals and derive some useful clinical information. For example, get several indices every 20-60 seconds. And there are several indices that we will not go into details. So for those kind of signals, what do you do? Like mainly, those indices or this information are used to monitor the hemodynamic trend during the operation. For example, are you losing too many? Is the patient losing too much blood? Or maybe we need to do something and so on. However, only partial information is used. That is, we only monitor the hemodynamic trend. And so far, to our knowledge, this kind of signal usually cannot be used to predict liver transplant outcome, and also for other surgeries, the same thing. So in some sense, it is a huge waste of 10+ hours waveforms, because in the end, you just get some small values, which from data analysis perspective, you can say physicians have done a very severe dimension reduction job and get something useful, but there might be more information hidden inside. So we are asking if we could properly quantify the hemodynamic structure, can we better understand the surgery or better assess the liver transplant outcome? So that is the basic motivation. So with this motivation, today's talk, I will give you an idea of the model and a new algorithm, which we call Roseland algorithm, and also some theoretical support of Roseland, and then come back to the application to liver transplant assessment problem I mentioned before. And in the end, depending on how much time I have, I will talk about some relevant topics. So let's start with some more observations of the non-stationary arterial blood pressure signal. So what you can see is, hey, the arterial blood pressure signal, ABP signal, is sinusoidal, and it repeats again and again. And what we can view it is the heartbeat, the heart, when it beats, okay, it squeezes an amount of blood into the cardiovascular system. And this impulse will behave like an impact to the cardiovascular system as a drum, So what you get is the response of this impulse to the cardiovascular system as a drum, and you repeat it. Oops, hold on, sorry, I have no idea what's going on. And you have the heartbeat, and the heartbeat repeats and repeats. And then at some moment you see, hey, the heart is beating, and at some moment the liver is removed, and you get some different responses and so on. So you can view our arterial blood pressure signal as a sequence of responses to a sequence of impulses that is generated by heart pumping blood into the system. And if you take a closer look at all the responses, you collect all the responses together, you will see, hey, sure, these three morphologies, they look very different, isn't it? You can see two small ears on the right-hand side. On the left-hand side, well, there is one ear, which is very tough, but there is no ear here. But in addition to this kind of global difference, if you plot them together, you will also see that from beat cycle to cycle, there is also some small variation hidden inside. So based on physiological knowledge, the hypothesis we have is the morphology of the impulse responses and the associated variability reflect the properties of the cardiovascular system, and which may be used to design some useful indices for clinical surgery assessment. Okay, so to kind of quantify this very basic idea, we need to write the mathematical model down. And what we propose to do is a manifold model for the nonlinear dynamics. What we do is, hey, recall, we have impulse and the impulse response, and we have a sequence of them. And based on a physiological fact that there is a variability, yes, there is, but the variability does not go crazy or random. That is, although there are some variations, but your heartbeat will not suddenly become white noise or become something like sound. No, it doesn't behave in this way. There is some rule guiding it. However, it is almost impossible, at least to my knowledge at this moment, to write down the very precise differential equation relationships to model what's going on, because most of the models I know are for physiological model under normal situation. When you have some physiological situation, getting the right model is kind of more challenging, and maybe we need some more efforts on it. So what we thought was, hey, how about if we do the following? We say, hey, because there is some rule, although we do not know what it is, but we try to model it and parameterize all impulse responses by a low-dimensional smooth manifold, in the following way, in this way. So we have a manifold, M, okay, which is a low-dimensional manifold embedding on some high-dimensional space, depending on discretization, or in L2 space. And for each impulse response, you can view each impulse response as one point on the manifold. And their similarities are quantified or parameterized by the manifold. Okay, so this is the manifold model that we try to describe the relationship among all cycles. And we need something slightly more. We need to describe the dynamics. What's going on in between those cycles? What's going on from one cycle jumps to another? So we write down this latent space dynamic model. So what we assume is there is a manifold N embedding on some Q-dimensional space, which is smooth compact manifold, we assume, and there is a diffeomorphism, and we get some M. which is another complex smooth manifold on the right-hand side. And what are they? What are they? So what we have is, we have the underlying latent space dynamics called zeta t. And this zeta t full field satisfies a stochastic differential equation, where A is the drifting term describing what's going on. And the dWt describes some, well, maybe some teeny tiny fluctuations that we cannot quantify. Okay, and this is somehow the model describing what's going on the left-hand side. There will be some dynamics. And we want to understand this dynamics in the end of the day, but however, it is inaccessible to us. But that's interesting. What can we access is actually the ST, which is on the right-hand side. And what we have is, you have this phi, capital Phi, the diffeomorphism we assume, that describes the nonlinear interaction leading to the impulse responses. That is, we know how to describe the intrinsic cardiovascular system status via some nonlinear interaction in between your cardiovascular system and your heart pumping the blood into the system, or observation. And there will be some inevitable noise, VT. And this is something accessible via the impulse response, the impulse time. That is, we have different time, as I mentioned, time T1, you have heart pumping, you generate as an impulse, you generate response. T2, as an impulse, you generate another response and you repeat. And what you can do is not really access or write down ST. Instead, you can only access S at discrete time, TJ. TJ is the impulse time. And so in the end, you will get a discretization of the dynamics on the right-hand side, and which are associated with the dynamics latent in the latent space. Okay, so overall, we have the model, we have the question, we have the model, and what is the signal processing step goal and the challenge? First, you certainly need to have physicians help to get the data, and it is not a very easy step, because inside operation room, you need to know how to dump the data, how to handle things, how to record things. There are many tiny details, but suppose we have done it, and you get the signal. And what we do is we truncate the cycle into pieces, and we get a collection of impulse responses, S1 up to Sn, in this way. And again, recall that we have the model saying that all these guys are located on the manifold. Okay, and what we want is to recover the latent space manifold and the dynamics. That is our goal. Well, it sounds okay. We have the overall picture of what we want to do, but we will face some challenges. For example, first, how to recover latent manifold. Second, how about if the data set is big and noisy? Remember, we have several hours of signals and we have many patients, and in the end, we may run into million or even 10 million different numbers of points, a different number of different sizes of databases. Then what can you do? And in particular, in practice, like we all agree that the data is always contaminated by noise. But the terrible part is that the noise is usually not Gaussian white, right? It's kind of colored usually, and it may be heterogeneous and certainly non-Gaussian. Then what can we do? And then third question is, what about if we can use how to obtain useful clinical information? What can we do? And today, I will not jump into the latent manifold part. If you're interested, I'm happy to chat offline, but I will focus on point 2 and show you a bit about point 3. and show you the results. Okay. Okay, so if no question, I will continue with the algorithm, which is called Roseland. And you will see that it is an algorithm motivated by many preceding works, but we assemble it in a way so that we can handle our problem. First thing first, we need to recall a very common diffusion-based unsupervised learning algorithm so that we are on the same page. So the diffusion on the database general setup is the following. You have point clouds, okay, x1 up to xn, and you can construct a graph. Okay, and how to construct a graph? There are several ways. You can construct it using complete graph. You connect all pairs, use KNN, use epsilon bow, whatever you like. You choose one, and you build up a graph. And then you want to make it an infinity graph to describe how similar two points are. So usually we consider the affinity between 2 points, xi and xj, and define in the following way. You can take any other kernels. But here I just use Gaussian kernels, or not really any kernel, and the kernel needs to satisfy some basic conditions. But let's say it's Gaussian kernel. And there will be some quantities you need to pay attention. First one is D, the metric. How to design the metric? That is, at least to me, the key of everything. But as I mentioned, I would not, I would not go into details about this because this metric we use will depend on recovering the underlying space. So I'll skip this part. Second part is how to choose epsilon, the bandwidth. And the bandwidth selection is a key. And we have some recent works justifying how to select epsilon. But again, I will not jump into it. This we need some kernel random matrix theory discussion, which may take too much time. So I decided not to cover it. But short answer for you is you take all non-zero pairwise distances and you fix a quantile that like a percentile, like 25% or 50%, and you use the 50% or 25% percentile as the epsilon. That will give you a guarantee when data is noisy. Then from the affinity graph, you can construct an n by n affinity matrix, which is very standard. And you can get a degree matrix, n by n diagonal matrix, which is nothing but you sum all the rows together and get a diagonal matrix. And you generate a transition matrix, D inverse W, which you generate a row summed one transition matrix, which describes a random work on the manifold, on the data set. And this is a transition matrix. So you get some random work or diffusion on the graph. Then what can you do? What you can do is you can do eigen decomposition. But here is a teeny tiny small detail you may want to pay attention. If the graph you construct is complete or by epsilon bow scheme, then that is fine. You can guarantee to have eigen decomposition. But if it is KNN, then in general, there's no guarantee because the matrix W you get may not be symmetric. So you need to be careful about it. And usually what you do if you use KNN is you try to symmetrize the affinity matrix or affinity matrix and so on. Okay, and some small teeny tiny details need to be taken care. But anyways, then you have eigenvectors and eigenfunctions. Then you can define something called diffusion map, which was proposed back in 2006 by Kaufman and Lafont, which is motivated by a very early work of local linear embedding, isomap, eigenmap back in 2000 or 2003 and so on. Okay, whatever. What you do is you take eigenvectors and eigenvalues, and for the eigenvalues, you raise to power t, and the t indicates the diffusion time. And for eigenvector UL, you focus on the ith entry, and this will represent the embedding of the ith point. So in the end, you will get several points embedded in a q-dimensional space. And it has several applications for sure, and has been applied quite broadly. At least I personally use it a lot. For example, it can help you to visualize high-dimensional data, dimension reduction, or recover linear geometry. And one special case is spectral clustering, which you can understand it from a manifold setup or non-manifold setup. But whatever, there have been a lot of theoretical justifications since 2000, even since 2000, 2003. And but the most basic theoretical foundation is spectral embedding theory based on a manifold. If you are a fan of manifold embedding, manifold learning, this was published in GAFA in 1994. Okay, and there have been several current works there are several groups trying to better understand what's going on. Okay, and certainly that is not an exhaustive list. If I miss any citation there and you are in the audience, please forgive me and please send me an email to correct me. And anyways, I just mentioned something I remember. Okay, and there are several. Okay, so sorry for it. Anyways, but however, although diffusion map has been widely applied, it has several limitations. In particular, when database is big and data is noisy. Okay, first, eigen decomposition is expensive. You can ask yourself in your computer, if I ask you to do an eigen decomposition of a matrix of 100,000 by 100,000, can you do it? Well, in my laptop, it's I remember maybe 40,000 is the limit, unless you start to play with some tricks like sparsity or so on. But anyways, it's expensive. So there are some existing solutions, as I mentioned. First, hey, you're a city, right? Why don't we just use sparsity, right? Good, you can do sparsity. You can do epsilon bow, but it is good only if the data is clean and you have theoretical support, everything. That's good. However, neighbor searching is not robust to noise, unfortunately. And you can see it in this very simple calculation. And what you see here is you have a noisy database, x tilde I. Okay, and xi is the clean data, and the xi is noise. And let's assume xi and xi are independent. And then you have a very simple expansion of the L2 norm. Right? We assume we consider L2 norm. If you consider other matrix, since it may become more complicated, well, better or worse? No ideas, it depends. But let's say it is kind of L2 norm. Then you see that, hey, there are three terms, right? This first term is something we are interested. Second term, third term, noise, right? So suppose xi is normal distribution of, and everything is good, Gaussian white. Then the L2 distance of xi minus xj follows to chi square p random variable. And you know that, what is chi square p? Chi square p has mean p and standard deviation square root of p, right? So when p is large, which means when the data is in high dimensional space, then this xi minus xj norm will dominate the signal, and this signal is super strong, right? But in practice, how can you control the strength of signal and the noise and the dimension? There's nothing you can control. And in many situations, the noise is high dimensional, the data is high dimensional, noise is high dimensional, and the data is very noisy. And the third term will further come into play, right? This guy is also random, also it has mean zero. So, well, we can say it is maybe less impactful, but you can see this guy may generate troubles. So that the so-called neighbors you find, or epsilon bow you find, are random, or inaccurate at least, right? Another solution is nice strong extension, which is nothing but you do subsampling and you run diffusion map or anything, and then you do extrapolation back to the whole database. Yeah, it's good. It's good for spectral clustering because we only need top few eigenvectors. So you are good. But when you want to recover geometric information, then sorry, the geometric information will be lost when you do subsampling, so that you may not be able to recover the geometric structure. So both of them are good, but they both have some limitations that we want to counter, in particular in some applications. So how can we do it? Okay, so our solution is something called diffusion via landmarks. What does it mean? So recall in diffusion map, if you are interested in diffusion from xi to xj, then you just do the diffusion directly, right? You just do diffusion, although I draw a straight line, just anyways, diffusion. And what we say is, what we asked before, actually with Chao, my PhD student who just graduated, we asked, how about if we control the diffusion via a landmark set? That is, we find some landmark set, y1, y2, y3, y4, they are landmark sets. There are some points in landmark set. And we force the diffusion from xi to xj through y1 to ym. That is, if you want to diffuse from xi to xj, then you have to go through y first. So you can view it as some kind of landmark constraint diffusion. And if you have this landmark constraint diffusion, what can you do? Can you gain any benefit? Or can you get some more controls? Okay, and the answer is positive. Otherwise, I will not mention it. But anyways, let me start with, let me introduce the algorithm. The algorithm called Roseland, which stands for Robust and Scalable Landmark Diffusion. Okay, the algorithm is very simple, only 4 lines. You can implement it in MATLAB, just maybe 10 lines maximum, very easy algorithm. So step 1 is you generate a thin, and tall matrix called WR, where you put the entries of WR matrix that describes the affinities between data and landmarks. That is, the IJS entry describes how you diffuse from xi to yj. Then you consider WR times WR transpose, which is the outer product of WR. And if you view it as an affinity matrix among data points xi, then that describes the affinity among data points. That is, the wij describes how you diffuse from xi to xj. And then, as before, you define a degree matrix. And then what you do is you run SVD. You run SVD of D minus half WR. You run SVD. And why do we want to run SVD? The reason is very simple, because if you view W here as our affinity matrix on the data points, okay, and the D is the affinity, is a degree matrix, and then D inverse W, the random walk matrix on the data point xi, is similar to this guy, and this guy can be written as the outer product of D minus half WR. So that the SVD of D minus half WR gives you the eigenvectors and eigenvalues of D minus W. And to get back the eigenvectors of D minus W, we just multiply D minus 1/2 in front. And so you get eigenvectors and eigenvalues of the diffusion matrix. And then you can just run the embedding, like diffusion map embedding as before. But now we use this landmarks-based diffusion result. So we call it Roseland embedding this time. And there are some symbols which you can ignore, but in case they are just put here, if you want to take a careful look, and later on when I describe the theory, I will need to use these symbols, but they are not. They are just essentially using eigenvectors and eigenvalues. So what is the consequence? The consequence is fusing the benefits of KNN, the sparsity approach, and the Nystrom, the subsampling approach. So first, you do not need to find neighbors. Instead, you find landmarks, and landmarks is just something you choose, right? And then you don't need to search neighbors. You just search landmarks, and landmarks is something you can determine just uniformly from the data or by your design. Okay, so no neighbor search is needed, but you get a scene matrix which speed up the algorithm. And the second, you do not need to do subsampling because the subsampling step is somehow replaced by the diffusion via the landmarks constraint. So in the end, all data points are used. You do not miss any points. And if you look at, do some simple calculation, suppose the number of landmarks m is written as n raised to power beta, and beta is less than 1, then you get the following complexity. For KNN-based diffusion map, no matter how hard you try, with sparsity, the complexity is roughly n to power plus epsilon, but Roseland becomes 1 plus 2 beta, which comes from SVD decomposition. And if beta is less than 1/2, then you see the algorithm becomes fast. Okay, although the algorithm Roseland is slightly worse than Nystrom, but it is kind of acceptable, as we will show later. And one example is when n is 1 million and dimension p is 300. If we take beta is 0.45, in this small computer, the computer I'm using to give my talk, this is a MacBook Pro 2017 model. It can finish in 3 minutes. So I think it is acceptable. Not perfect, but acceptable. And the student, Charles, who went to the industry, well, he may try it in a larger database because in the industry, they are usually working with larger database. And we are also having larger databases like 10 to the 7, 10 to the 8, and it seems to work well when you go to the cluster. And we want to mention that the existing landmark-based approach is not unique. There are some works that are similar to us. For example, this Haddad, Kushner, and the Koifman's paper, they have some similar idea, but the basic difference is the diffusion part is different. They do not really keep the diffusion structure, and they do not have proof. They mainly apply, suggest an algorithm and apply it to image processing. And there have been many papers using landmarks and saying, okay, with landmarks, they can do spectral clustering, some combinations. You can find them in an area, but they do not have proof. And they, to my knowledge, they do not have proof. And the normalization schemes are different from ours. Okay, so here is a very quick benchmark result, so that you have a basic idea. The MNIST database is a very standard benchmark, which nowadays is considered too old and maybe not interesting, but I think it's a good one, a very basic one to compare with different algorithms. And the runtime, over 70,000 images using diffusion map will run about 1400 seconds. And if you use Roseland, it will only take about less than 20 seconds and so on. And LO is an algorithm that the JM LOR reviewer asked us to compare. And if we do a comparison and it turns out to be not perfect, not very good, but it has its own benefits. And the Nystrom is very fast for sure. And then we have some standard clustering, so again, clustering accuracy matrix we consider. And if we do the comparison, then you will see that when beta is 0.4 or even 0.5, the accuracy of using diffusion map and Roseland becomes very similar, and it goes beyond 85%. And to our knowledge, if you don't do supervised learning if you just do unsupervised learning, this might be already very good. I don't know, according to our knowledge, the state of the art is roughly around this region. But if you compare with other algorithms like LLL, Nystrom, or purely PCA, you may go up to 65, cannot go beyond. And we also ate noise, try noisy data. That is, we ate some noise, and noisy data, the noisy data is look like this. We normalize the image so that it's in between 0 and 1, and we ate noise with standard deviation 0.2. Okay, and in this noisy data, you can get roughly 80%. So I would say this not bad, not bad. Could be better, but not bad. And this is a visualization of the whole surgery of one case. Okay, so remember the original motivation is liver transplant. So you get, you start from the, you start from the arterial blood pressure signal. And now we run Roseland embedding into 3-dimensional space for the visualization purpose. And we have 120K points and beta 0.48. It finishes in about 10 seconds. And this is the embedding. Okay, and in this embedding, you will see there are some small, teeny tiny curves, very thin curve. And there is a very thin, thick curve. And this thick curve is the median trajectory over, I remember, 30 seconds or 1 minute. Anyways, there's the median trajectory. And you can see the median trajectory describes what it happens and so on. And if we take a closer look and zoom in, then you will see that there will be some places, you see that's kind of a zigzag pattern. And here is kind of Brownian motion pattern and so on. So you'll see that the dynamics of the system is quite non-stationary. And we will come back to this slightly later when we talk about its application to clinical assessment. So, so in the, I think I have 10 to 15 minutes. So I think I can finish on time, but I may not be able to do relevant topics too much. But I think that's good. Anyways, so let's do some theoretical support of Roseland. So as you can imagine, I will do this manifold setup stuffs and so on. So let's say M is a d-dimensional manifold, smooth closed, connected, blah, blah, blah. And we have two random vectors, X and Y. Their associated density function assumed to be C4 with some regularity, and the info is positive, which means you can sample every point, everywhere. Okay, so you have some density assumptions. Then you just sample X and Y on the manifold, and the manifold is assumed to be isometrically embedded in Euclidean space. And now you sample IID points from X and Y from Y, and we assume M is related to N via N raised to power beta. Okay, so we have the setup. X is the data set, Y is the landmark set. And now we consider high dimensional color and the heterogeneous noise model. What we have is, hey, if you have X and Y, they are on the manifold, they are clean data. Now, nature is evil, right? We get some noise. So we get Xi tilde and Yj tilde. And we make some assumptions, otherwise we cannot do anything. I will assume that those noises are independent with mean 0, but their covariance may change, may vary from one to another, but they are always bounded by some sigma p squared, so that sigma p depends on p. That will be our noise model, which is colored, which can be heterogeneous, but they are independent. And we have some high dimensional noise model, which means P over N will grow to infinite simultaneously at the same rate, described by gamma. Okay, so that will be our noisy model. Now, first thing to say is, well, to save time, maybe I will quickly go through this part. The landmark design. Landmark design is a very important topic. For example, I told you we can select landmarks, right? But you select landmarks, but how to select it? And usually we just say, okay, you can just uniformly sample from original data, a subset uniformly sample from it, and use it as the density, as a landmark. But what we can show via some asymptotic analysis is maybe you can do better in case your interest is to recover Laplace spectrometry operator. Okay, because if you do some pointwise expansion, you will get Laplace spectrometry operator and some first order term, which depends on 2 nabla log p plus nabla log py. So in the end, if you choose py to be proportional to 1 over px squared, then this guy will become 0, and you recover Laplace spectrometry operator. And this is a very simple simulation telling you that suppose the original px is non-uniform, and the py is taken to be px, and if you do the embedding, you will see something very skewed. But if you choose py to be 1 over px squared, it is much better. Okay, and the more landmark design, it could be considered, but I am not really an expert in design, in experimental design. So this is the topic I'm talking to people, and if you have any ideas and so on, I'll be very happy to chat. The second one is L-infinity spectral convergence. Because as I mentioned, we will use the spectrum, the eigenvalues and eigenvectors of the graph Laplacian or landmark affinity matrices and so on. But in the end, we want to get to get spectral embedding of the manifold. So we need to know to have a guarantee if we can recover the eigenvectors or eigenvalues of the Laplace spectrometry operator of the manifold. So the theorem here tells you that yes, we can do it. Okay, and there are some manipulations. This is extrapolation steps, and those are the notations you saw before. Just to remind you, we can get some convergence. And I have to say the convergence rate is certainly not the ideal one. It could be maybe improved, but that is in our very recent paper, just accepted by information inference. We couldn't get a better, faster convergence or prove that this convergence rate is optimal. Okay, so, but anyways, once you have this, you can link the story back to spectral embedding. And in particular, there are 3 main papers, one in GAFA back in 1994, and the other 2 papers, recent papers back in 2016, describing, guaranteeing how you can get almost isometric embedding of the manifold using diffusion net, or even what we have, Roseland. And a similar result for graph Laplacian with not Roseland can also be done. And we had a paper back in 2021, and there's another group from Wisconsin and Minnesota also working on a similar problem. So far, how to get to the optimal convergence rate there is, to my knowledge, is still need more efforts. So if anyone has interest, I'm happy to chat offline about this and see how to get it, because I am not a PD guy. So maybe there are some techniques that is possible to achieve breakthrough, but I just cannot do it by myself. And this is the robust two-color and heterogeneous noise. And here I just show you the result with Gaussian noise, which only tells you that the embedding from noisy data and clean data. Okay, clean data and noisy data and clean data. Once you do some proper alignment, okay, you can get some proper diode. And what it tells you is something interesting. That is, if you take sigma p, okay, the noise level to be p raised to power 1/4 plus alpha, then no matter what, delta p will go to 0 in this setup. Delta p will go to 0. So this guy will go to 0. And in particular, if you choose epsilon to be of this region so that the eigenvectors converges, then you can guarantee that you have some stability results. However, if you take a look at this power, the interesting part is it tells you that the overall noise will blow up to infinite at the rate of square root of p. At the rate of square root of p. So which is considered to be big noise. Usually people, many people, when people do noise analysis, they consider noise level to be 1 over p, which means the overall noise level is fixed or even converges to 0. For example, some people may consider 1 over p squared, but to us, those kind of noise is too small and not practical, because in practice, noise is so big that you can see it. And so we prefer to model it using some larger things. So we need to do some controls. Okay, and the same results, similar results hold for more general noise. Remember student T4, like if you have force moment noise, some not too bad tail, then it is robust. It doesn't need to be Gaussian. Okay, so the final few minutes, I will tell you the application to liver transplant assessment, and so that you have an idea of the application. So the overview is this is the data is collected from Taipei Veterinary General Hospital, Taiwan, which is the hospital I did my residency a long time ago. And they are my classmates, and they spend a lot of time recording the data for me, and some surgeons and so on. But anyways, in the end, we get 60 cases, and 4 failed in the very end. And there was up to 2021 last year, and thanks to the COVID pandemic, the data collection process was not very smooth. But anyways, we get data sample several channels. Sampling rate is 300 Hertz. But today I will only show you the result with the APP signal. And for other channels, many channels, this kind of sensor fusion things that will be an independent talk where I need to set up more frameworks. So you can see, as I mentioned quickly before, there are a lot of details in the Roseland embedding. You see in this region, it is kind of like Brownian motion, but here it's like zigzag, 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 zigzag. So they have several different dynamics. So after talking to physicians, okay, how could I model, provide the index so that you can use more conveniently, and that you can accept, you can understand what we are talking about. We came out with some clinical indices. They are very simple, but they are efficient. The first one is called trajectory fluctuation movement index, and another one is the trajectory trend movement index, which are nothing but quantifying the high frequency part information of the trajectory and the low frequency information of the trajectory. You can view it in this way. So you can view this as just a high pass filter or low pass filter, and then you evaluate the average. Very simple idea. Nothing difficult. We can do more, but that's for clinical paper. So we just decided to do it in a simple way. And then what we do is we have 60 cases, and okay, so well, sorry, my pointer is dead. Ooh. It's dead. Okay, so anyways, after surgery, after we move the patient, close the wound of the patient, and move the patient to the intensive care unit, we can start to monitor the patient. For example, total bilirubin or direct bilirubin, TB and the DB. These two indices are blood lab chemical indexes that physicians use to decide if the liver transplant is successful or not. And we found that the index we collect during surgery, before the abdomen was closed, has a strong correlation with the index after moving the patient to the ICU. Okay, which I will not elaborate further. It tells us that during the surgery, the usually abandoned, wasted arterial blood pressure waveform may contain sufficient information that suggests the transplant outcome. Okay, so that before the wound was closed, it's closed, right? We can tell physician, hey, man, do you want to take a second look? According to our prediction, there may be something not going very well. Physicians can select to ignore it, but if he takes a look, maybe he can save the patient. You don't want to go to the surgery operation room the second time. That will highly increase the mortality rate and many things. Okay, so how much time do I have? 1 minute?
Yeah, something along,
Okay, 1 minute.
2 minutes.
Okay, 2 minutes. I will quickly go through the last part, the relevant topics. But well, what I want to say is first, what about if there are multiple components in one signal? For example, in this fetal transabdominal maternal fetal ECG signal, then what we propose is we can apply the shape algorithm and the manifold learning algorithm, combine them to decompose the signal into 2 parts, and then run the previous algorithm. But this is again a whole different topic. Okay, and there have been several applications with different teams to do electrocardiogram or brain intracranial cortex EEG and so on, and the cardiogenic artifact removal. And if you have multiple sensors and even heterogeneous, for example, your EEG or respiratory signal, you name it, then what you can do is you can get, oops, what's, anyways, there are some kernel sensor fusion techniques that can help you to identify the similar information, common information, and the most important thing is different information among different channels so that you can carry out multi-resolution analysis. And this is the direction I'm working on recently, and which is very challenging but interesting. You need to take some notion into account. Okay. And the last part is the heat kernel reconstruction. We can do heat kernel reconstruction from the manifold, just and some theoretical guarantees. And we have some applications to design the Gaussian process regression that respects the geometric topology or geometry of the manifold and applied to airflow reconstruction. Okay, so the application is like how to continuously record airflow signal, understand pulmonary function tests, and so on. And the basic idea is if you understand how your chest and abdomen move, then we may have a relation, we may have some knowledge to know how you breathe through your nose so that we can get your pulmonary function evaluation. So the proposed algorithm was using regression model and get some feature extraction based on time frequency analysis to get some predictions on the manifold, and we construct some regression model, and so that we can predict the flow signal when you do not have the flow signal. And this is the Gaussian process. The key information here is the covariance now is replaced by the heat kernel. And the heat kernel will help you to recover to respect the geometric structure of the manifold. And the main benefit here is maybe if I can show it. No, I cannot show it. Okay, fine. It respects the intrinsic distance, so that you don't need to worry about the contamination of Gaussian process by the geometry, which is shown on the right bottom plot. There are a lot of artifacts. Okay, and this is a very glimpse of the results showing how the airflow signal is recovered and so on. And the paper was accepted for publication in CSDA this year, and we are continuing to explore more and so on. So that is my whole talk. Thank you for your attention.